Hey everybody, welcome to my podcast, Suchitra's Life, with me, Suchitra. And in today's episode, I managed to catch up with Priyanka Yenigalla, who's a maxillofacial surgeon and also a facial aesthetic surgeon. In this conversation, I managed to know a little bit more about her profession, and I also managed to ask her some questions and put her on the spot. But she has her answer, and she is very clear and direct in her conversation, and she has a really soothing and calming aura. So let's dive into the conversation. So, Priyanka, hi, welcome to my podcast. How are you doing today?
I'm doing great. Thank you for asking. How are you?
I'm great as well, Priyanka. I know you are a maxillofacial. Am I pronouncing it correctly?
Yes, that's the correct word.
Sure. So you're a maxillofacial surgeon and also facial aesthetic surgeon. So I want to know what's difference between them. And even first, I would like to know more about you. Like, how many years of experience do you have, and how did you even come into this field, which is very complicated, actually, I feel.
It was quite easy. I started in 2005.
Oh,
Uh, and during that time, it was just a very basic step. Like as soon as you finish your 12th standard, you don't know what to do. And I got into BDS, so I just started the journey. After getting in, I realized that there's more to the story than meet the eye. And to be very honest, there were two specializations that I was very interested in. One of them was pediatric, pedodontist, and other one was maxillofacial surgery. First, I applied for the pedodontist, pediatric dentistry, which I didn't get through. I was delayed by an hour.
oh, okay.
So then I got into maxillofacial, which was my second choice. But once I started maxillofacial, it was quite a journey, to be very honest. Very deep and very tedious work. And requires a lot of dedication because head and neck is that one region which is very complicated by default because you have nose, you have ears, you have eyes, you have mouth, you have head, you have neck. So everything converge in that particular area, if you get what I mean.
Mm-hmm. Yeah.
So once I started the journey, I thought that this is not going to work for me. The reason because it's too vast and I cannot be a jack of all trades. So I decided to pick something one that I'm very interested in. So head and neck oncology and facial aesthetic surgery was what my calling was in the end.
Oh, great.
After a few wrong turns.
That's great. So,
Yeah.
what's the difference between both, by the way?
What's the difference between?
Maxillofacial and facial aesthetic. So, maxillofacial is like just.
Maxillofacial, see, maxillo itself pronounce it like it describes itself that is maxilla, the upper arch of the mouth, and facial surgery is what. How do I explain it? Um, how do I explain this? See, the maxillofacial is how your teeth are aligning with each other
Mm-hmm.
and how it is in proper symmetry with your face.
Okay.
If that makes sense to you,
Yeah.
I'm trying to simplify it because it's very easy for us to use the scientific words, but when it comes to explain to layman, it's quite tough.
Yes, yes.
So maxillofacial, why it is called maxillofacial is very simple
Mm-hmm.
because it's your teeth which has to align with your face. So let's say there is a asymmetry, there is a deformity in your face,
Mm-hmm.
so there will be a problem in the chewing as well.
Oh, okay.
So that's why this is an integration of dental and face. That's why it's called maxillofacial.
Got it.
And if you go into the facial surgery, Then we do, you have seen like nose job, lip job,
Yeah.
ear job, and all those things. That is what the facial aesthetic surgery comes in.
Oh, okay. Mm-hmm.
Okay, so usually those are done by plastic surgeons,
Mm-hmm.
but even a maxillofacial surgeon who has been doing these surgeries for past few years can also get into that, provided they are working in a hospital, because hospitals have all the equipments. These things cannot be simply carried out in a simple basic clinics.
Mm-hmm.
You need to have a proper setup of OT.
Oh, okay.
Yeah. So
Mm-hmm.
if you have an OT, you can carry out certain procedures
Mm-hmm.
under certain protocols for sure. So that is the difference between facial aesthetic surgery, where you only aesthetically enhance a person's face,
Mm-hmm.
and maxillofacial surgery is where you cover almost everything, from the trauma, deformities to the cancer.
Oh, okay. And and you said there are some categories in maxillofacial.
Yes, in maxillofacial surgery, in India it is not yet, I mean, it exists, but people are not aware how to move forward in that category. But in abroad, like Europe, Russia, Middle East,
Mm-hmm.
and USA, all these countries, they are very highly developed. UK including. In UK, you have to spend 20 years to become a maxillofacial surgeon.
Oh,
Yeah. So, because they have to do MBBS, BDS, then maxillofacial.
oh, okay.
It is a rule of UK government, so they have to follow this protocol just to become a maxillofacial. So in abroad, what they have done is that because maxillofacial is so deep, so vast, that they have subcategorized it in.
Mm-hmm.
Like I can be a general maxillofacial, but in within maxillofacial, let's say I found a niche in facial aesthetic surgeries like rhinoplasty, lip augmentations, raising your eyelids, all those things. Then I will only go into the facial aesthetic surgery, cosmetic procedures, facial cosmetic surgeries.
Mm-hmm.
If I'm more interested in head and neck oncology, then after my maxillofacial, I can do subspecialties in head and neck oncology, where you see the cancers in the head and neck region and you try to approach them through surgical.
Mm-hmm.
And then you have trauma, where the people meet with an accident and they come with severe deformities and immediate attention. Then you work with a couple of other specialists like general surgeon, neurologist, ophthalmologist, and all those people, and you try to save a person's life. That is with RTS.
Mm-hmm.
And then there is a pediatric deformity, facial deformity, and pediatric head and neck oncology, which is altogether a very different approach.
Yeah.
So these are the very few which I have touched, very few subspecialties.
I understand. Thank you for sharing that. I mean, that's something, people who are aspiring to be in the same field as yours would definitely benefit from. And so can you tell us about some challenging cases that you've dealt with? I mean, it's okay, you don't have to like soften the details because I am particularly very scared of blood and all that, but I'm just trying to keep myself.
No, I understand. I understand. But for me, in general, head and neck oncology is very brutal.
Mm-hmm.
To be very honest, I fell in love with oncology long time back.
Mm-hmm.
But once I got in, I realized that oncology is so brutal that there is no definition to explain what a person must be going through who is undergoing the cancer treatment, what their entire family is going through.
Mm-hmm.
Uh, some of my worst cases were laryngectomy, which I still don't. I mean, it's very easiest procedure to be very honest compared to many other complicated surgeries that we have done. But I don't like that procedure because it is it is that procedure where you take out the voice box of a person,
Mm-hmm.
so they cannot talk anymore. They have to use a device to speak. So because I'm a very spiritual person,
Mm-hmm.
for me, I don't believe in laryngectomy procedure, because in spirituality you have seven chakras,
Yeah.
and one of the chakras is throat chakra.
Yeah.
So I believe that Earth has an electromagnetic field, your body has an electromagnetic field.
Mm-hmm.
So all your seven chakras align with the electromagnetic field of the Earth. Now imagine if one of the chakras are taken away from your body, then entire your electromagnetic field changes.
Mm-hmm.
So that's where the Vedic science and the modern science has a conflict, because laryngectomy kind of these all procedures do exist in our Vedic science as well, but their approach to these procedures were very different. Now the modern science has more aggressive approach, and laryngectomy is one of those approach where we take out the voice box and it changes the entire frequency of the human body. That's why I personally don't like that. And apart from that, we have many other complicated surgeries where we have to resect the entire jaw of the patient, and there was a severe deformity. It is not easy for the patient also to accept themselves in the mirror,
Yeah.
for their family, for their children, everybody. So for me, I believe every head and neck onco procedure
Mm-hmm.
is a brutal procedure. Doesn't matter if it is a small or big, every head and neck onco procedure is brutal and complicated.
Mm-hmm. Yeah, I mean, I think the pain, whatever.
Yeah, the pain, the agony, the financial, setback, and apart from that, acceptance of the patient and acceptance by the family members.
Mm-hmm.
Especially if you have a young children, then for them to accept their parent going through is very difficult.
Mm. I understand. Yeah, it must be like quite burdening for everybody involved.
Yes, yes.
So, Priyanka, so can you explain some latest advancements that have happened in maxillofacial, like since you've started back in 2005 up until now? What
Hmm.
changes have you seen, and what are the ones that appealed the most to you?
For me, the most is nanotechnology.
Mm-hmm.
Nanotechnology is still, on the very basic stage in India. They are still not able to integrate how to use it together,
Mm-hmm.
but it does work. It does work. So nanotechnology is one thing that I really like. That is one of the advancement. Robotic surgeries is one of the advancements, and oncology we have advancements, but they are surgical advancements. For me, I strongly believe that if we have an advancement in prior diagnosing the cancer, that is the greatest advancement for any humankind. So every person, if we can simply diagnose it with an advanced technology, it will save them with lot of traumatic surgeries, if you know what I mean.
Yeah, true. I agree. And so, how do you keep yourself updated with any upcoming new techniques or technologies that you have?
I am one of those who, go. Usually, people love shopping around,
Mm-hmm.
going to the malls and all. But I am shopaholic in related to the science. I'll attend any kind of scientific events. Doesn't matter if it is related to my specialization or not.
Mm-hmm.
If it is something I can afford, I will just jump in. The reason why I like it that you can always take something from each specialization or different scientific events, and you might apply them in your current scenario. You never know, because science is evolving. It's evolving at a rapid speed. So you have to keep up with it. You cannot say, "Oh, I'm not a specialist of this, so I cannot attend that."
Mm-hmm.
If you want to understand what science is, you have to attend. You have to read a lot. That is my most important aspect of my life. I read a lot, I research a lot, and I always try to find that bridge that can integrate this gap, that I feel that okay, I can take that advancement from there and I can integrate here.
Mm-hmm.
And to integrate that, we need to build that bridge. So I work mostly on the research work. I understand. I try to meet the people who have done the research work and see how we can integrate these philosophies and turn it into much bigger projects.
Amazing. That's, I think, I mean, I, I had a doctor in my family who
Mhm.
passed away long back, but he was also like, I think all I see is they're just studying. There's no end to it, but yeah.
Even that's true. If you get into medicine, there is no end.
Mm,
There's an forever evolving journey. There's no end to it.
hmm.
So I think you will always, for the rest of your life, you have to keep reading, reading, reading. Doesn't matter.
Exactly. So, Priyanka, you said that you're a spiritual person, right?
Mm-hmm.
So, I mean, it's a kind of like a generic debate that, science and spirituality, there's like some conflict, because science is all about logic and spirituality is something beyond that. So, how do
Mm-hmm.
you balance these two perspectives that you have in yourself, like, you know?
It is a very simple answer. I mean, it is very difficult for the normal person to understand, but it's a very, very, very simple answer. To understand spirituality, you have to understand science first.
Mm-hmm.
Spirituality is a science in itself. Without science, spirituality cannot exist,
Mm-hmm.
and without spirituality, science cannot exist. Now, over the period of year, centuries and after centuries, what happened? The mankind started to disconnect with what we call spirituality. Again, remember, spirituality is not a religion.
Mm-hmm.
So they started to disconnect with these spiritual life,
Mm-hmm.
and they started to build everything based on the science, which is they think they call it logic.
Mm-hmm.
But if you go back some 4-5 thousand years ago and you look into our Vedic science, it is clearly mentioned the science is spirituality and spirituality is science. They're not two different entities.
Mm-hmm.
They cannot coexist independent. They cannot exist independently. They have to coexist. So every time you try to divide them, there will always be more chaotic relationship among them. But if you try to bring them together and work together, there's always harmonic existence.
Got it.
So, like I said, everything, even the scientists today, they accept that our electromagnetic field has a very significant effect on Earth, and Earth has a very significant effect on us
Mm-hmm.
because Earth also has electromagnetic field. So imagine, uh, I'll tell you a very simple example of cancer itself.
Mm-hmm.
Now, why do we have a cancer? Because we are triggering that particular factor, which which is supposed to stay dormant,
Mm-hmm.
not supposed to be awake. But every day I'm walking and I'm rubbing my body to a plastic bag.
Mm-hmm.
Every day I'm going and stuffing my face with a lot of junk.
Mm-hmm.
Okay, so these are what triggering factors. So every day I am triggering the dormant genetics in my body,
Mm-hmm.
and now they are suddenly awake. They don't know what they have to do,
Mm-hmm.
and they are forming their own frequency, which is disrupting the electromagnetic field of a human being.
Mm-hmm.
So when that electromagnetic field is disturbed, your spirituality is disturbed, and you start developing disease.
Oh.
It is such that simple.
Mm-hmm.
If you if you just stop triggering these factors, it is very easy to live in a harmonic life
Mm-hmm.
with spirituality. They are not two different things. And there are many great scientists who are still doctors, and they still preach a lot of their patients to go on to meditation. Meditation is not to improve your concentration, but to relax the cells in your body. Very simple.
Mm-hmm.
When you are going into a different type of meditative force like alpha, beta, theta,
Mm-hmm.
when you start with this meditations, they actually calms your cells,
Mm-hmm.
and your cell will not repetitively develop into abnormalities. Now there are two types of developments. Let's say now I'm a healthy person. Tomorrow I woke up and I have rubbed some kind of a allergy kind of a thing. So immediately my cell is awake and thinking that, okay, this is how I'm supposed to divide now. So
Mm-hmm.
it start dividing in abnormality. So when you do this certain type of meditations at certain levels, you're calming your cells down and you're pushing them to come back to normal electromagnetic field and divide in that mode only,
Hmm.
not in abnormal mode. So that is the whole idea about the meditation, not that you will gain some spiritual enlightenment.
Mm-hmm.
If you understand your body at that basic level, that's how you evolve as a spiritual person. It doesn't happen overnight.
Mm-hmm.
It's a journey. And that's how you will understand the science also.
Yeah. I mean, is this how you calm your patients as well? Because I feel so calm talking to you.
uh, Most of the time, we have to speak to our patients. That's the thing that most of the young generation doctors they don't spend time with their patients.
Mm.
You should not sell the products. You should not sell the procedures.
Mm.
You should understand what your patients want. Explain them what is right and wrong.
Mm.
Let them know. And no matter what decision they make,
Mm.
you have to respect it.
Yeah.
So once, see, there are times when we have repeatedly told the patient not to, like, this is the problem with this procedure. These are the pros and cons of it, but it's up to you. They often choose the one that will lead to problems. But every time the patient comes back to us, we don't rub it on their face. See, we told you, but you chose this.
Mm-hmm.
So at that point, what we can do is that we can all calm them down
Mm.
because they have come to us with a faith. I cannot say that, see, I told you, but you made the decision. Sleep on it. I can't say that.
Yeah.
They're in pain. They understand the decisions they have made.
Mm.
So I have to help them. So when you counsel them repeatedly, that calm down, do this certain procedures,
Mm.
do this meditation, walk in the nature, because nature has a very strong influence on your body.
Mm.
So when they change a little bit of their lifestyle, you'll start seeing some changes in their body. So once they develop that confidence again, then you proceed with any type of procedures.
Mm-hmm.
Then you explain them again. And that's when they understand the significance of what doctors are trying to tell them.
True. Um, so also Priyanka, like nowadays, like I'm seeing that everyone, I mean,
Mm-hmm.
especially people we see in the media, celebrities and all, uh,
Mm-hmm.
like I was telling you earlier, they all look the same. It's thing. And is
Yeah.
it even healthy to get lip fillers, Botox?
Mm, see, anything in excess is always a danger.
Hmm. Hmm.
I get my Botox done, but I don't get Botox done frequently.
Hmm.
It's like once a year or once in 2 years,
Hmm.
which is normal for me. A
Okay.
lot of my, there are some people who says like, you do Botox and fillers, but you don't do it on your face. I said, that doesn't give me the inferiority complex where I have to go and get it done.
Hmm.
If I'm able to accept myself and I'm happy with myself,
Hmm.
I don't need to get it done.
Hmm.
When I feel like, okay, this is the time I need to get it done, I'll just go and get it done. I don't need a permission. I don't need to prove it to anyone.
Hmm.
The same thing applies to my patients as well.
Hmm.
If they are willingly accepting those Botox and fillers,
Hmm.
let it be.
Yeah.
All you can say is that you can explain them, okay, this is the limit. Don't go immediately for this. Give it some time.
Hmm.
That's all you can say. But you cannot say this is wrong.
Hmm.
So Botox and fillers, anything in limits is good.
Hmm.
And second thing is that some patients, I have seen certain patients who have done it excessively,
Hmm.
but somehow their body responds amazing.
Hmm.
It doesn't give them any adverse effects as such.
Okay.
So it is also the acceptance of a patient.
Hmm.
If a patient will keep thinking, oh my God, I'm getting so much done, definitely I'm going to fall sick, you will definitely fall sick because you're consistently thinking about negativity. There are some of my patients who get it done excessively and they keep saying that no matter how much I get, I am very happy. I look better. I look best.
Hmm.
So every time they're projecting out, they are looking better and best. Because if they're thinking how they want to carry themselves, how they want to project themselves. So I believe these are all personal choices,
Mm,
and why everybody is looking the same is because nobody is trying to understand what their body needs. Everybody wants to get what others are getting done.
mm.
So I think that is why everybody is looking same to you. But we always suggest that always see what is best for you, not for the others.
Mm, mm, mm. So, do you see there is an increase of people who do not need it also are getting interested in it and they're just getting it done? Does that happen?
That never happens. If a person is not interested, they are not interested, period.
Mm-hmm.
You cannot motivate them, especially in India, because in India we still have the concept of natural looking.
Mm,
Even if they get lot of botox and fillers, even if they get a simple semi permanent tattoo also,
mm, mm.
they will still try to project, oh, this is my natural lips. you know so they in Indians we still stuck to the fact that we are natural.
Mm, mm,
Okay. And so most of the Indian women, what I have seen is that
mm,
they feel that getting a Botox filler, all this thing is kind of a, oh my God, she is getting it done.
mm,
That nothing is natural. I want everything natural.
mm,
But we also have to understand that our grandmother times we didn't have this type of pollution, junk food and plastic.
yeah.
Now we are very prone to these kind of things. So our skin, our body is changing.
Mm,
To keep that healthy, we have to do something about it.
mm,
Not in an excessive way, but we have to do something about it. But there are many people who still think that no, no, natural is what we want.
mm, mm,
So those people you cannot change mind. They are very made up. They know what they want.
mm.
There are some people who are, juggling whether I should get it done or not. So all you can do for them is that you give them the pros and cons and let them decide.
Mm-hmm.
If not today, maybe after a year they'll come back, or 2 years or 5 years, but they will come back.
Mm-hmm. Yeah, that is interesting. So, Priyanka, so what advice would you give to someone who's considering a career in, maxillofacial, as a surgeon or a facial aesthetic surgeon? Oh,
I think
yeah.
mm, the suggestion is very simple.
Mm-hmm.
Don't think maxillofacial surgery is like a some big shot kind of a thing.
Okay.
It's still a surgery where you cut open the body and it is still going to affect the patient.
Mm.
Even if you do the aesthetic procedure, it is not necessary that post aesthetic procedure the patient will accept that body, even though the patient is agreed to those type of changes.
Mm-hmm.
Okay, even the aesthetic procedures, we sit with the patient, we explain them this is how you're going to look, we show them some. If you have a virtual model, we show them. If you don't have, we will just explain to them how it is going to change. In spite of doing all this counseling, it is not necessary the patient is going to accept it. So my personal suggestion to all the young surgeons are is that if you really want to get into the surgery, first learn to be down to earth.
Mm.
You're not God, you're no better than the other.
Mm-hmm.
You have to understand there is a human life.
Mm.
Sometimes they will accept it, sometimes they'll not accept it. And there is a lot of challenges that is going to happen in your life. So I personally feel the younger generation surgeons of India,
Mm-hmm.
they really don't know how to act as a surgeon and how to relate to the patients, because most of the younger generations are influenced by these shows, you know, Grey's Anatomy, House, and whatnot. But that's not the reality. That really doesn't happen. Yes, some of the scenes, yes, they do happen, but not everything is what they show in the show.
Mm.
Not everything is true. So I think it's high time that we come back to earth and realize that we are actually a surgeon and anything can happen on the OT table. and you have to be prepared. You cannot drag the hat of I'm a surgeon.
Mm-hmm.
It took me a while to say that I'm a maxillofacial surgeon. It's only after 4 years I'm very confidently saying it
Mm-hmm.
because I'm still hesitant. When I'm doing the surgery, I'm all the time thinking like, my God, how is the patient going to wake up?
Mm-hmm.
Even though with all that counseling and motivation,
Mm.
my all the time thinking like, how are they going to accept it?
Yeah.
So it took me a while to accept myself that I am so and so.
Mm.
So I think that will be the best suggestion that I would be giving to the younger generation is the just calm yourself down,
Yeah.
understand what surgery is, and understand what is at stake, and always be down to earth.
Mm-hmm.
Always, no matter what.
Mm. That's great advice. Thanks for that, Priyanka. So
Thank you.
finally, I'm curious, like, how do you balance your professional and personal life? Because as far as I know, doctors don't have personal life.
To be very honest, I don't have a personal life, but I do take time.
Okay.
There are times when my body just give up. I cannot work. I know. I start to feel sick,
Mm-hmm.
and I know that I have to immediately go and take a vacation.
Mm-hmm.
And every now and then, me and my colleagues sometimes go out for a good dinner, lunch, or we just meet people, random people. If you're single, yes, we meet people. If you're married, then yeah, we will just hang out with husbands, boyfriends, whoever it is.
Yeah.
So it is not always, it's not like every night we go out, but once in a while we have to go out because even we have to recharge ourselves. Otherwise, we cannot do the best.
Exactly. So your education and all, you've studied in India or have you been abroad?
I have studied in India.
Mm-hmm.
I have done my bachelor's degree in India and my MD is from Russia.
Oh,
Yeah, and then my fellowships in Dubai and some in India, some in Russia.
how was that exposure to, Russia, Dubai, the cultures there?
Oh, don't believe CNN. It's absolute opposite to what CNN has projected all these years.
Mm-hmm.
Dubai is a very safe place for women. Dubai, Saudi Arabia. Yes, they have restrictions, which we should be respecting because the same way they're respecting our culture, they're respecting our Hinduism, they're respecting our sari. So we have to respect that too.
Mm-hmm.
And Russia is the same thing. They are Russians. They are very straightforward people,
Mm-hmm.
but they're not that bad.
Yeah.
I have so many Russian friends that I barely had any Indian friends. I think one or two. That's it.
Mm-hmm.
Because I could sink in with their mentality. They're very normal, and the only problem in Russia is that they don't speak English,
Yeah.
even if they know.
Oh God. So you
They will
learn
stick to
Russian.
their mother language.
So you now can you speak Russian?
I can speak, read, write,
Oh my God.
listen.
That's
Yeah, it took me a while, but I'm getting there. I'm not perfect, but yeah, I can manage.
so like when you were studying there, I guess even the textbooks and all were in Russian or was it?
Yeah, I had to sit and by heart so many words in Russian,
Oh my
the scientific terms and all. But now it's like, I'm used to it.
God.
Though I cannot write the thesis on it, that is still a very hard work,
Mm-hmm.
but I can read. I can understand the scientific terminology. I can understand what is written for the patient and all those things, very basics.
Mm-hmm. So why did you choose Russia? Like, are they like really good when it comes to this field?
I I applied for few of the countries, and Russia happens to be the cheapest back then.
Okay.
What I'm paying in India and UK, I'm paying half or yeah half of it in Russia.
Mm.
Just a very little amount in comparison to other countries. And after going to Russia, I realized that Russia is a very highly educated country.
Mm-hmm.
They just because they don't speak English, so they don't think that Russians are educated, but they're very educated people.
Mm-hmm.
In fact, at least they have 3 to 4 PhDs. Each Russian will have 3 to 4 PhDs,
Oh my God.
and they read a lot. They read a lot. If you're sitting in a metro,
Mm-hmm.
you will find younger generation are into the telephones, Instagram, and all those things. But if you look little older generation, they're always with a book. They're always reading in the metro, in the parks. You go, they are always reading. They're very highly educated, well-read people.
Amazing. Amazing.
Yeah.
And thanks for breaking all those, wrong rumors about these countries.
No, I think Middle East and Russia are one of the finest countries.
Mm-hmm.
The thing is that we shouldn't just think that because they're very fine, they're very humble, you shouldn't just go and misbehave with them and like say anything. You have to know your own boundaries as well. So if you know that, if you know how to respect each other culture, I think it's very easy to sustain anywhere in the world. And that's what Russia has taught me.
Mm.
Russia, apart from education, it taught me how to be with people.
Amazing.
You have to listen to people. You have to make the habit of listening. The more you listen, the better it's going to get for you.
Yeah, I also get into this habit of only talking. This podcast helps me to listen to people.
No, no. I think the more you, I'm a very good listener. I mean, I'll keep listening. I'll keep listening. Judgments are always the last thing, but I will listen and I will try to understand where the person is coming from.
Mm.
Once you understand that, it becomes very easy to interact and integrate with such people. You don't need to judge based on what you hear from the news channels and everywhere.
Yeah, exactly.
So I think listening will always going to help.
Mm.
That should be the, I think, motto of every human.
Exactly. And also when if I am at a doctor place,
Yeah,
I, I mean, I'll see if they are willing to, know
listen.
me or, know me on a personal level and, suggest some, the way they talk, some people are very, transparent.
Strict. Yeah.
Like, okay, I'll just have to take my medicines and go. But someone
Yeah.
calms me down, I go back to them again and again, and I,
Yeah, that's because see, when they're coming to a person, to a doctor with a problem, they're not just expecting to be treated. They're also expecting somebody to listen to them without any judgments. Because everybody is doing that around them, their family members or outsiders or friends. Somebody is all others doing that to them. So when they come to the doctors, they predominantly expect that, please don't judge me, but just listen to me, my problem.
yeah,
So when they tend to just, listen, it cures half of the disease, to be very honest.
exactly. Mm-hmm.
Yeah. It calms them down. Half of the diseases are from stress itself. So
Exactly.
when the patient is calm, everything is good.
Mm-hmm. Yeah.
Yeah.
Exactly. So, thanks a lot, Priyanka, for sharing your valuable insights with all of us. It's been like amazing, amazing talking to you. And
Thank you so much for the opportunity. I highly appreciate it. I would love to know more about you, maybe post the call.
definitely, definitely. So,
Yeah. Thank you so much. It was nice talking to you.
same here. Same.